Hey, welcome back to Not So Complicated, and today we'll be talking about sulfonylureas. These are oral antidiabetics, right? So let's begin without further delay. In introduction portion, sulfonylureas like Glipizide and Glyburide are oral antidiabetic drugs. As I have said earlier, they are used in type 2 diabetes to stimulate insulin release, right? So this is the mechanism of action, how they work in a concise figure. Sulfonylureas bind SUR1 receptors, and that is how potassium sensitive ATP channels are blocked, causing depolarization of the beta cell membrane, and that will lead to the increase in voltage dependent calcium channel opening and influx of calcium, right? And that will lead to calcium mediated exocytosis of insulin, that will increase plasma insulin level and thus decrease plasma glucose level. So that is the overview. Mechanism of action is that sulfonylureas bind SUR1, that is sulfonylurea receptor 1 on beta cell membrane, a subunit of ATP, like potassium sensitive ATP channels, and then that will close potassium channels, preventing potassium efflux, that will lead to the depolarization of beta cell membrane, right? And this depolarization opens voltage gated calcium channels, allowing calcium entry to the beta cell, and this will trigger insulin release by like exocytosis, calcium mediated exocytosis. And enhanced insulin release lowers blood glucose by promoting glucose uptake in tissues and inhibiting hepatic gluconeogenesis. Gluconeogenesis is the formation of glucose from non-carbohydrate sources, right? So that is inhibited, and this is the mechanism of action of sulfonylureas. The side effects are hypoglycemia. Obviously, if there is increased in insulin concentration, that will lead to hypoglycemia, and that is manifested as shakiness or confusion or dizziness, right? And then especially in elderly or renal impaired patients. And increased insulin promotes fat storage, leading to 2 to 5 kg of weight gain. So weight gain is also a side effect of sulfonylureas. And if there is any allergic cases, sulfa cross reactivity, that will lead to rashes. And the other side effects are GI upset when it happens, like prolonged hypoglycemia occurs, right? So confusion with meglitinides and metformin. These are two other drugs that are oral antidiabetics. And meglitinides like repaglinide, they also bind SUR1 but act faster than sulfonylureas with shorter duration, right? And reducing hypoglycemia risk. And metformin. So metformin is not actually hypoglycemic drug, it is euglycemic drug. It increases insulin sensitivity, not secretion, and that is via AMPK activation pathway. So we'll be talking about metformin in detail in our next video, our upcoming videos, right? So that is all about today. Subscribe for more clinical polls, and thank you for staying with me.